So my name is Dr. Dave Williams, President and CEO at Southlake Regional Health Centre in Newmarket. So I think it's a really exciting day at Southlake. We've got this tremendous collaborative partnership with ORION that provides us a high-speed telecommunications capability that will enable us to provide virtual care, collaborate with academic research centres and with innovators.
I'm Carolyn McGregor. I'm the Canada Research Chair in Health Informatics at the University of Ontario Institute of Technology. So my original thoughts and concept for Artemis came when I met a neonatologist at the turn of the millennium. And he said we have all these medical devices and we use the data in that moment, but then we summarise to a number in a chart every hour. And I asked him, well, what happens to the data that's in those devices? And he said it stays in memory for 72 hours and then it scrolls out of memory and it's gone.
Well, Dr. McGregor said, what if? What if we gave the capability to a computer to be able to real-time monitor in a way that humans cannot do? What can we do with a capacity like that? And the answer is we can predict up to 24 hours ahead of time which babies will decline and get sicker, and we can intervene earlier.
And when a baby's heart beats more than 7,000 times and they breathe more than 2,000 times, that's an awful lot of summarising to just come up with one number every hour. 1,200 or more readings a second per person we're sending. And they're not in the unit just 9 to 5, Monday to Friday. It's 24/7, 7 days a week. So we need a reliable infrastructure to be sending large, consistent volumes of data so that we can process it remotely and then send back summaries of information to give them new styles of information to use that data to improve healthcare and improve outcomes.
Well, you know, it's a transition. We're building a capacity for the future. The future of healthcare will be digitally dependent, data-driven, technologically enabled, and ORION will be a fundamental platform that we'll be able to build on.
And to do that, we need these commitments that we have from the Ontario government with infrastructures like ORION. Because I can't have a network that can go down. I can't have a network that I can only use from 9 to 5. Because we have peoples right here, right now, who need 24/7 support. The ORION infrastructure is not just a really big pipe for communication, but it's built with the highest quality.
Everybody cares about healthcare, right? And it's not just about having a longer life, it's having a richer life. And with Carolyn's work you just saw today, it's not just about the data, streaming data that she's got. That streaming data can now be shared with doctors all around the world. You can't do that anymore. It's all these collective minds coming together to helping solve the problem as opposed to one individual solving the problem.
We have the potential to save thousands of lives. The medical doctors usually have that one-to-one point connection, whereas as computing people, we're trying to put infrastructure in to save thousands.
This is why I joined ORION. This is the difference we can make. This is what we enable. We enable others to have a difference in the world.
Whether it's Artemis or whatever platform providing this big data analytics support, we have to, as a world, fix every single neonatal unit and not waste the data and use all the information that the baby is trying to tell us about how it's feeling, about how its health is, and use that so that we can help them leave the hospital healthy and be those next innovators in life in the future.